Joan, how can we help you? Joan, are you still... Hi, Joan.
Hi, how are you?
We're great. How are you today?
I'm good. This is really an interesting program. I'm on the back end of 50 and have rosacea, and my face still breaks out like a 14-year-old. But I've been treating it topically with a dermatologist, and he at one point said that, you know, I needed to start to take medicine on a continued basis, and I don't want to take anything that I have to take every day. But
you don't
anyway,
need to.
The other thing I found really interesting was that you're saying that this is affected by the digestional tract. And
right.
I'm just wondering, does Crohn's affect rosacea?
Yes.
Yes, it does.
How?
Well, what happens is Crohn's is going to cause a breakdown of the intestinal lining. Subsequently, your digestive enzymes are going to be aberrant. Also has a lot to do with certain types of bacterium, and as long as those things are present, then the external representation on the skin, as we talked about earlier, stomach, large intestine, and so forth, which manifest on the face, are going to be altered, and you end up making the rosacea much worse.
And you've also got a double-edged sword with Crohn's, because the Crohn's disease itself creates a malabsorption. In other words, you don't absorb the things that you need to, but it also has a problem with causing a breakdown in that physical barrier we talked about earlier in the gut. And so things that should not get through do get through, and things that should get through do not. And so you have a decreased nutrition of the whole body. And again, anything that causes an aberration of the nutrients getting into the system is going to be reflected in some people by skin problems.
Joan, when I was an intern many, many moons ago, as my son would say, before the dinosaurs reigned the earth, one of my first patients was an ulcerative colitis patient. And this young guy not only was emaciated, but his face was not cachexic, but also broken out. And once we got the intestinal system to start working through acupuncture and neurological balance and nutrition, his face immediately cleared up, as well as his ability to put weight on. So the intestinal system has to be looked at first above everything else. Also, 80% of your primary immune response, your initial immune response, comes from the intestinal tract, not anyplace else.
That's right.
Hope that helps.
May I ask one more question?
Sure, go ahead, shoot.
My kids also, who are in their 20s, still have horrific face problems, and one of them happens to have, what is it? Not diverticulitis, but I don't know.
Irritable bowel?
Irritable bowel, right. So that too affects, correct?
Absolutely. Same thing.
Same thing. And a lot of people that have these kinds of troubles really have to be very careful about their diet. Because that does form the foundation of any of the treatment successes that you're going to have with anything else that you do. Keeping away from the things that don't work for you, eliminating the inflammatory foods that don't work for anybody.
Strong probiotics, but good ones.
Good digestive support and good probiotics. All of those are key players, as well as good fiber to make sure that the body is eliminating properly.
You know, if a person didn't do anything but wanted to challenge this, all they had to do is a couple things. Eliminate all the junk in the system: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, preservatives, additives, my mantra, and put a good, strong probiotic in it. Go get a good proteolytic enzyme from a reputable health food store. You can try that. But the point of it is that it has to be specific. You have to eliminate the bacteria, the bad guys that are in there. Heliobacter is one of the things that just rips the body up. There's also all kinds of other things like Citrobacter and Klebsiella and so forth that raise havoc. And then you have to balance the nervous system, the acupuncture system. The body will heal. It's just a matter of getting the junk out of the way so you can put things into place to allow it to do what it's supposed to do naturally.
And even if you try to do that for 3 weeks, just take all the junk out, eat nothing but clean vegetables, fruits, bean products, and non-adulterated poultry and fish, and eliminate all the junk and get a good probiotic. Just do it for 3 weeks and see how you feel, see what happens to your complexion, and then if you want to really challenge it, put the junk back in and see what happens.
Yeah, it would seem to me that once you got fixed and you noticed that it was getting better, I wouldn't put the junk back in.
You probably wouldn't do it.
You know, why screw it up again, right?
But people might want to test that theory.
Yeah, there's a lot of doubting Thomases out there. So if that's who you are, you know, have fun.
And in 3 weeks, your body will do a tremendous amount of healing, and you'll get a real loud complaint if you start challenging it with the old stuff.
Joan, does that help you?
Yes, and thank you guys very much. Very informative.
You're welcome.
Thank you.
You're welcome. Joy, are you still holding? Joyce, are you there? Joyce?
Yes, I'm here, Doctor.
Hi, how can we help you?
Good afternoon. Thanks for taking my call.
Thank you for
calling.
calling.
I love your show.
Oh, you're very kind. I appreciate that.
Okay, I've had psoriasis for about 7 years on the sides of both of my heels, and the symptoms started after I was treated for strep throat with antibiotics. Every dermatologist I've seen over that period wants to start treatment with antibiotics, which I've refused because that's
after they caused it to begin with.
Yeah. So, and it's so unsightly, doctor, that I no longer wear sandals or flip-flops in public. I've tried multiple over-the-counter topical treatments with minimal to no results. Is there anything I could do that works?
There's a lot of things that you can do. First, think through why it took place to begin with. You were given an antibiotic, and now you end up with psoriasis. Mm-hmm. Well, antibiotic therapy, as we said, is the good and the bad thing. If it's appropriately directed, it's going to kill the bug that it's going after, but it also knocks out every good bacteria that you need to have in your intestinal tract. So what it's done is it's gone after the good guys as well as the bad guys. So the triggering mechanism is very straightforward. That's what caused it. So now you need to look at what the integrity of the gut is. You have to look at essential fatty acid metabolism, and you have to look at vitamin D. Now, we talked about acupuncture systems starting on the face, but they also start on the feet. They also start on the hands. They also, and then they go back and forth. So on the feet, you have the spleen meridian, you have gallbladder, you have liver function, you have bladder meridian, and stomach. Those are all the ones that either end or start on the feet. So stomach, we have liver, we have gallbladder. All has to do with digestive function. So it went through it and knocked it out. Probably liver function problem, as we always see any psoriatic case, but now we have to heal the intestinal lining. So you can be helped significantly if you want to try a couple things by yourself. Clean your diet up dramatically. Add vitamin D if you're not taking it. Without seeing your blood work, you can safely take somewhere between 2,000 and 4,000 units a day. I would take a very, very strong probiotic. Go to a health food store, ask them for an organic, very strong source. And whatever the dosage is on the bottle, or they tell you to take one capsule, slowly bring it up and take one, and then no problems every other day, take another one, every other day, take another one, until you get about 6 or 7 or 8 of them in your body and see how that works. But that's just the beginning. There's other things that has to be done, and unfortunately not knowing you and not knowing your medical background and so forth, and whether the acupuncture system is balanced or neurological pathways are balanced, that's, as they say, is a different story, but you can start with that.
Okay, Doc. Thank you
so much. If that helps, and if I can do anything for you, please let us know. Call us or write me at rosellecare.com.
I sure
Joyce,
will.
thank you
so
very much. I appreciate it. Thank you, ma'am.
Bye-bye.
We're here at 888-630-WMAL. We'd love to talk to you. My guest, Sue Roselle. We're here at the Roselle Center for Healing. We're celebrating Have a Heart Day, and we're trying to raise money for those who are less fortunate than most of us, trying to bring them health care that there's no way that they could possibly absorb. Talked to you a little earlier. Thermography Centers of Fairfax is contributing to Have a Heart Day. They are offering, during the month of February only, a normal thermographic examination of the breast. Normally $225. They're offering it to you at $198. And for those of you who call today, Roselle Center for Healing will donate in your name $10 to Caring for Others. So give Dareth Painter a call at 703-943-7248. That's 703-943-7248. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. My guest today, Sue Roselle. We're talking about many things, and we've had a lot of callers. Some of you we're still not going to be able to get to, but we're going to try to get to a couple more before the show's out. We have had a ball today. We're at the Roselle Center for Healing. We're celebrating Have a Heart Day. Many of you have come in and are seeing our staff, our doctors, and are donating to Caring for Others, and we appreciate it. We thank you. We couldn't do it without you. Caring for Others is a very special organization. They go out and they provide integrative alternative healthcare services, chiropractic, acupuncture, nutrition, to those who have nothing. And in addition to that, provide scholarships to guys that are going to acupuncture, nutrition, and chiropractic colleges, acupuncture colleges, and we request that they give back to their community as a result of that. But we have more information, and the FDA is doing it again. They are creating a jihad, if you will, against everybody. But we won't get into everybody. We're going to get into a very specific company, Diamond Company, which produces nuts. And the FDA bureaucrats are trying to control the nuts that you eat. I'd like to control a few nuts in my life, too, but that goes without saying. The FDA is saying that walnuts are bad for you. And when you tell people that walnuts can save your life, they can increase your omega-3 fatty acids, they're good for cancer therapies, and, you know, Sue, I don't know. You got to throw the nuts out.
Yeah.
You know, the walnuts that we have at the house, you got to throw them out.
No, don't think so. But basically what it is anytime anybody makes a comment about a food's benefit in protecting or correcting health issues, then it falls, according to the FDA's ideas, that it falls within the realm of medications or drugs or whatever. And that holds true for herbs, that holds true for foods. Soy got hit a long time ago.
Well, how this came about is the FDA has gotten their nose bent out of shape because Diamond Corporation actually went out and said that walnuts, you know, are good for you for your health. You know, they're promoting the health benefits of walnuts. They're saying that they can help with heart disease and diabetes and cancers and so forth as a preventative. And the thing of it is that they do. And they produce levels of arginine, and arginine is great for vasodilation. It helps your heart. It does wonderful things. So, you know,
that's why Mother Nature gives us these foods. They're not just something that fills the hole in our tummies and stops the growl. They're there to help protect and help our bodies thrive. Walnuts, like a lot of other nuts, are packed full of good-for-you healthy fats. They are not saturated. Now, we're talking raw, unsalted ones that have not been changed and added to. And they give you monounsaturates, they give you omega-3s, they have high doses of antioxidants, and most importantly, it's the best source of vitamin E. People always say, where can I get my vitamin E from food? Well, beside green leafy vegetables, there you are, the nuts and the seeds, because they carry the complete vitamin E complex. You know, everything we need.
Walnuts are great, and like I said, everything should be organic that goes into your body, including walnuts. But it's good for so many things, and we could spend another program not just talking about walnuts, but the benefits of all the factors that are in walnuts. The problem here is this: there's a new act that was just signed in February by President Obama, and it's called the Food Safety Act. And you need to be very careful because, in my opinion, this is the back door to the Codex Alimentarius, which we will spend another program on. But having said that, we still have callers. Rosalind, how can I help you? We have a minute. I'd like to take your call.
I heard you tell someone who had the same problem as I do, brown spots after I've taken Lasix, 40 milligrams, you know, the diuretic. And you said something can be done about it. What can be done?
Well, the first thing that you have to do is Lasix, as side effect, has skin pigmentation changes. And it's a result of throwing out a lot of the different minerals and electrolytes in your body. One of the primary things is potassium. You have to look at also how it alters fatty acid metabolism in the body. The melanin in your skin is altered because of that. So we could actually spend a whole program on that. But you have to be able to get off of the Lasix, and obviously you're taking it either for heart problems or blood pressure regulation. So do me a favor, write me at rosellecare.com. I will pick this up again. I will write you directly, and I also will pick the question up next time when we're on the air. Thank you, Rosalind. I appreciate it. I'm sorry we don't have a lot of time. You know, this is the problem, Sue.
I know.
We don't have the time.
We're back to the 3-hour show.
I know. We got to have at least 3 hours, and we're up against it, and that's the way it is. We're here every Sunday at 12 noon, bringing you the most up-to-date information that we can on integrative care. Check us out on Facebook, RoselleCenterForHealing.com. We blog every day. This is Dr. Tom Roselle. See you next week. Bye.